An emergency room physician says he blames Fox News and other right-wing media outlets for what he calls deceptive propaganda, negatively impacting some patients' decisions about getting the COVID-19 vaccine. In an op-ed, Dr. Rob Davidson writes this: "I don't blame my patients for their refusal. I do blame Fox News and the other right-wing media outlets for poisoning the minds of millions of Americans. We must do what science and evidence tells us demonstrably work to defeat COVID-19. Wear a mask, get vaccinated, and stop watching Fox News." Dr. Rob Davidson is an ER doctor and the executive director of the Committee to Protect Healthcare. He's a patient advocacy. It's a patient advocacy group made up of medical professionals nationwide. It is great to see you again, doctor. I will tell you, I don't actually call it Fox News. I call it Fox because it isn't news, especially as we have seen here during the pandemic, some of this stuff, dangerous stuff that is coming out of there. But explain to us why you said what you did, that you don't blame your patients, you blame Fox.
Listen, I've seen several COVID patients now every shift for the past week, and every single one of them has been unvaccinated. When I see other patients, I offer them the vaccine. I try to talk to them about the vaccine, and so many of them are just shutting down the conversation. I had one patient tell me they're afraid of the ingredients in the vaccine, and I asked, well, which ingredients? And they said, well, I don't really know what's in it. And we're in a highly Republican area, about 40% vaccination rate, about 70% voted for the former president. And when you see what's being put out there on the airwaves with Fox and other organizations, and then that is, shared on Facebook, and it just hits that echo chamber, it is undeniable that these messages are getting through to patients and they're avoiding something that can prevent them from getting extremely sick or potentially dying.
Is there any specific misinformation that they're citing, or is it sort of vague, as you just described, that you ask someone, you probe their concern, and it turns out they don't actually have a concrete concern?
It's extremely vague. It's just, and some people, it results in them getting very angry and they just shut down the conversation. They don't want to talk about it. And it's just inexplicable from a healthcare standpoint. I've been doing this for 20 years. When someone comes in with chest pain and I recommend an EKG and blood tests and x-rays and sometimes admission to the hospital, I don't get this kind of resistance because they're relying on my expertise, my training, my knowledge of the issues. But unfortunately, with this one disease, we have a huge number of people getting their information in so many other places, including Fox and others. It's just going completely against what we as healthcare professionals are telling them to do.
You write, one predictor of vaccine refusal is Fox News viewership. And you also note that they should listen to their family doctors for medical advice, not Sean Hannity, whom researchers have connected to higher infection rates. That is frustrating that they're not listening to you when it comes to COVID. That is the advice, I think, of a lot of public health officials. They say, listen to the doctors. But it sounds like that's going unheeded.
It is. And my wife's a family doctor. We talk about this nearly every day after her days in the office. She spends half of her day talking about vaccines, and some people get frustrated. She said, listen, just like I recommend mammograms and other screening tests, if I didn't talk to you about this and then you catch it and you get extremely sick or die, I'm going to lose sleep over it. I'm going to feel bad about it and feel like I didn't do my duty. So, bless the primary care doctors out there who are doing this every day with most of their time with their patients, unfortunately.
What do you think needs to be done to combat this misinformation?
Well, I said it in the piece, and I believe it. If people would just turn off Fox, turn off other media channels, turn off Facebook, and just go talk to their doctors, that would get us there. But short of that, it really is going to be those private, personal conversations with people's family doctors that take care of all their health needs and their families. It's going to work in every case. It's maybe going to work in the cases, but it will in some of the cases. And slowly, I think we'll get to a point where we get enough people vaccinated where we can see our way out of this. I hope.
Yeah, we certainly hope so. Dr. Davidson, we'll let you go. We know you have a shift to begin. So thank you so much for joining us from your car this morning.